Welcome to the Psychiatrist's Waiting Room, a show where I interview my dad, a psychiatrist who's been in the business for 50 years, a true OG, all about mental illnesses. The aim? To explain the complexity of mental illness in as simple terms as possible. Welcome, Dad.
Good morning, Georgia.
Today, we're talking about anxiety, focusing on what a generalised anxiety disorder is. 1 in 5 Australian adults, firstly, experience a mental illness every year. 45% of Australian adults will be affected by mental illness at some time in their life. Anxiety, mood disorders such as depression and substance use disorders are the most common mental illnesses experienced by Australian adults. The main mental illness is anxiety. Firstly, 17% of the population, that's 1 in 4 people, 3.4 million Australians, have anxiety. Now, what's the difference between anxiety and a generalised anxiety disorder?
Let's begin with the flight-fright episode. If you look at a movie, say, about dinosaurs, Jurassic Park, you'll always see the same sort of creature attacking human beings. You see a big, ugly dinosaur rushing into and screaming with its mouth wide open and frightening the people. This is what's used by lots of movies. So the basic thing that causes anxiety are rapidly approaching objects, dark rooms, loud, awful sounds, strangers, or being isolated. In the movies, you have all of these in the jungles of the island of Jurassic Park, and this frightens the audience enormously, who will get a sort of subjective fear. So is fear anxiety? Within fear, there is the anxiety symptoms. So that's the best way to explain it about where anxiety is in the general population. So those 5 particular things I just mentioned, if they're around 1 or 2 of them, you'll get a mild anxiety, and if you get the 5 of them, you'll get an extreme fear and anxiety. So in the general population, we'll all have episodes like this and know what anxiety is. So we will feel a stress, we'll feel a need to escape, and we'll find that our heart rate and our breathing's increased, and we want to vamoose out of here. Mm-hmm. And that's all of us have experienced that in life.
Yeah, natural fight.
But some
response.
people get the anxiety without the dinosaur, without the dark room or the loud sounds. It just gets triggered on its own over minor things. And so the person is being overwhelmed by minor things when the threat is very minor or not there. Or they don't even have a threat. They just happen to have the episodes occurring. So they feel anxious. And so a lot of the public have this. We might call them nervous. But it gets to the point where this starts to interfere with your life and you can't work properly, your relationship's suffering, you're not able to parent well, and so on. And you become disorganised and disordered, and therefore you end up with an anxiety disorder, which means you're malfunctioning because of that condition.
Why is it that a lot of humans now are getting anxious over things that they don't need to be anxious over?
Well, for some reason humans like watching bad news on television. Good news TV failed, but bad news TV has been very successful. And it's just part of nature that it all goes back to the fear of the unknown and what could possibly happen. So when we watch television, newspapers, we even talk with friends and so on about unlikely events causing a major problem, we're concerned about that, but we're inundated by it all the time.
Now you're saying it's environmental.
Oh, that's why the increase. Yeah.
Yes.
I think there's a base line of anxiety, but why is it increasing more in our current society? Yeah. society is becoming more complex. Even every day you've got to learn something new on the internet because you have to update your bank asks you to update things, or your email address, or whatever it is that you've got, and these are continually harassing you from day to day.
Okay, so society is really, the pressures of society is creating a lot of anxiety.
A lot of change is taking place continuously.
How much of this is genetic?
Well, we're talking about something different now. We were just talking about anxiety there. Now, when we're getting to genetics, we're talking about the disorder. So in a disorder, which is not a large percentage, maybe 10% or 15% of people, we don't really know, that are disordered by their anxiety, it runs in families. It actually runs in families. So they tend to call that familial rather than hereditary, because there's a mixture of modelling on the anxious parent, or being influenced by the anxious parent, or having the genetics of the anxious parent.
And what is it about genetics that makes someone anxious? Is it a serotonin issue? Is it can't imagine it's a neurological one, but is there biologically, what is malfunctioning in your body to make you anxious?
Well, yes, the idea is that the serotonin, dopamine, or adrenaline, those particular chemicals are disordered, and it's primarily a dopamine and an adrenaline issue.
It is. So then for the ones who have the disorder where they become paralysed and can't function normally in their day-to-day living, they take the medication, anxiety medication, to balance out the serotonin and dopamine. Is that correct?
Well, it depends on the medication you're dealing with. There's basically two medications, which is the antidepressant SSRIs, and they work on those neurotransmitters we just mentioned. There's also the benzos, like Valium, and which work on a different network called GABA, and I think GABA aminobutyric acid, and they work in a different system, and they actually relax you in a different manner, including relaxing your muscles and your thoughts.
Going back to the environment, because there's a lot of talk around trauma these days, dealing with trauma from youth, and just sort of making one's way through the jungle without thinking that was just a normal part of life. Later in life, they realise that trauma that they grew up in has created anxiety. Is that correct? Trauma.
Yeah, I suppose so. If a child's being sexually abused or physically abused or verbally, and he's not aware that what's happening, that's how life is until they will have anxiety, but they will think that it's part of their existence until they leave home and find out that other people aren't like that, and then they notice that they are different, and then they start to recognise the symptoms, or somebody tells them about it, or a therapist, and they become aware that if they're racing heart or difficulty breathing or their fear, the way they think or they avoid things is now part of condition rather than their world that they live in.
There are some really good medications out there for anxiety. What are your thoughts on the natural therapies? Like, I have seen that they play an incredibly important part in reducing one's anxiety. That's things like meditation, yoga, cognitive behavioural therapy, CBT. What's your view on these?
Well, it depends what we're treating. And if you've got a very severe case of anxiety where the person's so disordered, they'll require medication. CBT therapy is extremely good, probably the main tool in most anxieties and anxiety disorders. People learn how to stop their thinking processes, how to control their breathing, how to deal with their intruding thoughts by techniques that the psychologist is expert at. The other one is, of course, is what is the cause of the anxiety. And, of course, this is the most important thing that a doctor does, or any therapist, is looks at the underlying cause rather than just treating the symptoms. So there are anxieties as part of other mental illnesses such as obsessive-compulsive disorder, post-traumatic disorders, alcohol, drug addiction, etc. And there's even conditions like thyroid disease, etc., which mimic anxiety. and are not actually anxiety, but they're due to being hyperactive thyroid. So the doctor has to sort of get to the bottom of why they are the way they are. And even with ADHD, we'll know that people who are forgetful, disorganised, will develop low self-esteem and become anxious. So you may have to treat the underlying disorder for all of those conditions mentioned and some of the ones I haven't mentioned.
Would you say a large percentage of anxiety is an environmental response? Because it does sound like it.
I think anxiety in general, not the disorder, is environmental.
Mm-hmm.
And it depends on how you were brought up and how you were educated and how you manage your life. And then if we eliminate those, that there's a separate cause for anxiety, like the conditions I mentioned recently, then we get just down to a plain generalised anxiety disorder. If we can isolate that, how much of that is genetic? Probably most of it, yeah. It's very hard to actually make that diagnosis because life is complex. People are having difficulty in relationships and having difficulty, and they get masked by drug taking. Or it's a very interesting topic, anxiety, because it's not as clear as some of the other psychiatric conditions.
And it's quite broad.
And there's many causes.
One cause, let's just chat about quickly actually, is for me, it was sugar. So I found that if I was in a stressful situation or high pressured and I was eating lollies and then had to go and do something high pressured, for example, give a presentation or, meet your boyfriend's parents for the first time, I couldn't have sugar beforehand because I would get this raging anxiety. And I noticed this when I was about 20 and I thought, I can't eat sugar. And it was just a fleeting thought and I stopped it. Today I know that balancing your sugar levels out during the day is extremely helpful for anxiety. But it was funny because a few years ago, an author in Australia came out with a book called I Quit Sugar, and she claimed that not eating sugar eliminated her anxiety or diminished it substantially. And I remember you got quite worried about that because I remember you saying, now I'm going to have these patients cutting out sugar thinking it's the answer. But it was fleeting. It didn't really happen. I remember you being worried, though. Why were you worried?
Well, let me just go back to the original preface that you also described having anticipatory anxiety, and we haven't talked about that.
Right.
And you anticipated that if you took sugar, you would have an anxiety episode, but you're already anxious before you actually got anxious because you were anticipating it. And a lot of people have anticipatory anxiety and then get performance anxiety, which we haven't talked about either.
Yes.
And they're separate things, but they're probably understandable by most people who will have issues with public speaking or having to be in the public eye. But getting back to do substances cause anxiety? Of course they do. We know that with people who are on all the types of drugs, the illegal drugs, and even some of the prescribed drugs. But if we get to a natural substance like sugar, getting a sugar hit, well, the trouble with sugar is basically in big doses it becomes addictive, so you get these highs and lows. So you get a rapid high and then you get a crash effect. So you may be getting anxious about the crash effect, or you may be just getting anxious about the fact that you're behaving in a different way because of the high. That's what I think it is. Whether it's biological or not is another matter. But the reason I got concerned about it is I thought that it was one of those panaceas where patients would give up their medications, their psychology therapy, and rush off and put themselves at risk by going on, sugar-free diets and things like that, and going off to various health farms and fads.
And stopping everything altogether. Yeah. There has been talk of people who have gone to those health farms, completely stopped everything they know, and they get a massive anxiety. But the awareness around that is really good now. What's the solution to anxiety, Dad? What is the solution? Is it a matter of having a very good medication plan, self-awareness, going on programs? It does boil down to self-awareness at the end of the day from what I see. But how do you see the future of anxiety and how to treat it best?
Well, in my practice, in recent years, particularly since the government allowed psychologists to receive Medicare benefits. there's been a great shift. I've noticed over the years a move that patients become aware that anxiety, first stop of call is a psychologist, and they tend to do the CBT. And it seems to be probably the best start, because when we're just talking about anxiety in general, people are learning to manage their life in the workplace, in a relationship, parenting. That's probably the best first port of call, other than the GP. But once that is not working, or one has made a diagnosis of a disorder, they should be seeing a psychiatrist or even the GP to commence them on some sort of medication. And the first ones are the SSRIs like Zoloft or Prozac or Lexapro. And they're usually very effective. Sometimes we'll use the benzodiazepam, but the medical profession is very cognizant that it can be addictive, and they try and use that for a short period of time or not at all, or leave it up to a specialist to manage those particular drugs.
Now, do you think anxiety is on the increase, or do you think even if it is on the increase, we're managing it better?
Yeah, no,
what's your final...
managing it better. The people I see now who got anxiety would not have come to see me 30 years ago.
Right.
They'd have managed it.
Yeah.
But what there is there are services available now, and people use them. If they use them, they'll function better. They'll be more productive for society.
All right, Dad. So on that note, we will wrap it up. If you'd like a question answered about mental health, please email me at georgiacassimatis@yahoo.com. See you next time. Bye. Dad.